Welcome, folks, back to the basics. Today, we will be talking about the causes of low back pain in children. Low back pain is not a very common problem in children. Children are very mobile, they love to play, and when they are playing, they are very much prone to traumatic conditions. I mean, they can fall, they can injure, and when they get a variety of injuries, they can also get back pain. But in particular, this lecture is not focused on traumatic back pain. I mean, obviously, that's altogether a different domain in which the trauma can cause back pain, and there are various reasons for that, obvious reasons for that. But anyhow, the crux of this lecture would be on non-traumatic low back pain, which is not, as I told you, it's not very common. But when it does present as a diagnostic challenge because there are a plethora of various reasons and conditions that can present as low back pain in children. So, without further ado, let's dive in and get started. Uh, First thing, let's start with the background. It's relatively uncommon, but whenever it is present, chronic or acute low back pain, and I'm talking about non-traumatic back pain, it has to be considered abnormal unless proven otherwise. So remember, there would be some good reason for low back pain in children, non-traumatic low back in children, unless until you have done all the investigations and you find out that there is no good reason for this back pain and you just clear the child medically. Now, various research have been done and they show different statistics. Uh, as far as the adolescents are concerned, I mean, this is the age group where most of them would present with back pain. And one study in which they included 446 adolescents aged between 13 and 17 years, they found out that 26% of them, like that's probably one fourth of the adolescents in this age group, and the teenage is a very active age group, they reported some form of back pain related to sports. Again, we are not talking about trauma, we are talking about sports. I mean, trauma can be related to sports, but that is a different entity because there is a history of some direct, blow to the back or some form of direct contact of the back with something which is pointed or something which is hard. And this usually happens, when somebody falls from a height or gets injured in a fast moving action. But nevertheless, I mean, with sports where there are strain on the back, one quarter of the adolescents in one study, they have reported some form of back pain. Whether it was bothering them or not is another thing, but they presented with some form of back pain. Now, when the back pain becomes chronic, especially those children which had back pain of more than 2 months duration, chronic backache, low backache, uh, 33% had a post-traumatic etiology. Now, there they had some form of trauma in the past, which probably was not what do you call something which was noticeable, but resulted in an occult fracture or spondylolysis. So either there's a fracture which was hidden or spondylolysis, which is basically considered to be I mean, not truly a pathological fracture, but it's more of like a stress fracture, which can occur because of repetitive strain, especially those who are gymnasts or those who are doing ballet dancings and things like that. So and another 33%, like that was one third, had some form of abnormal back kyphosis or scoliosis. So either the curvature of the spine was tilted to one side, scoliosis, or like in an anterior posterior direction, or as kyphosis. And 18% had some form of tumor or infection either in the intervertebral discs or in the bone, which was responsible for chronic back pain. So chronic back pain usually is pathological, and as I told you, that various studies have found out that a good chunk of these patients have got some form of pathology. Now, as far as the male and female distribution is concerned, that's 1 to 1. They say 50% of the tennis players and soccer players, they usually complain of backache. Up to 85% of gymnasts, male, especially male gymnasts, they report back pain at some point in while they're doing sports, and especially those sports which require continuous extension of the leg in the posterior direction. Again, because it's like pulling a lot of ligaments and muscles which are attached at the lower back, especially on the hip bone and on the sacroiliac part of the the lower back or on the lower vertebrae, that causes a lot of repetitive strain, and that can lead to low backache. So this was a little bit about the background of the low backache. Now, coming down to the etiology. So, etiology can be grouped together into various groups. Like you can have infective causes, which are relatively rare. You can have inflammatory conditions, which can give you low back pain. Again, more common. Mechanical, obviously related to posture, related to your sports, or related to the type of work that somebody's doing. And then obviously orthopedic reasons, where you've got some problems with the bones, some form of malignancies, especially related to the bone, either primary or secondary. Systemic diseases, certain types of diseases which are like multi-system disorders, they can present with low back pain, and there is a category for this. So let's take them one by one. So infections, which are relatively rare. So if somebody's got sacroiliac joint infection, rare thing, but let's say where the sacrum is meeting the ilium part of the hip bone, if that gets infected, uh, obviously, basically this would be a sort of a septic joint, rare in that particular area. But I mean, rare things can do happen. I mean, that can cause low backache. Vertebral osteomyelitis. So if there is bone infection of the vertebrae, obviously, because that is the exoskeleton that is taking your body weight, that's going to cause low back pain. Discitis is a serious condition. That means inflammation of the intervertebral disc, and usually this is in children. Obviously, in most of the cases, it's usually a blood-borne infection from blood, like the bacteria can seep into the intervertebral disc and can cause discitis, and that can cause severe low back pain with fever, and a very toxic condition. Pyelonephritis is basically another condition. Well, infection of the renal parenchyma, but because their kidneys are located posteriorly on the back, so that referred pain can be felt as a low back pain as well. And then spinal epidural abscess, again, and it's a serious condition in which there is abscess formation in the epidural space, in the lower, uh, back spinal spaces, and that abscess can be, can present as a low back pain, again with fever, and some other signs as well. Psoas abscess, which is not common these days, used to be common when people had POTS disease, TB of the spine, and and the those vertebrae would collapse, the pus would go down into the psoas muscles, and would cause like psoas abscess, and that would cause pain along with the movement of the hip joint. And anyhow, I mean, that can present with as like a chronic, a dull, low backache, and to some extent that pain is felt in the groin as well, and that pain is aggravated by movements of the hip joint. Then coming down to some of the inflammatory conditions, like these are inflammatory condition in which there's some form of endogenous inflammation going around in the joints or in the tendons. One is ankylosing spondylitis. Now, ankylosing spondylitis basically is and sort of an arthritis of the spine, more common in males, especially in those who have got the human leukocyte antigen B27. I mean, almost like 90-95% sort of association with HLA B27 antigen. And they usually start with like some form of low back ache, and then usually the spine says, what happens is that because of the inflammation, the spinal process, they get fused to one another and usually end up in a bamboo spine, sort of a typical posture. Reiter syndrome or reactive arthritis can happen in the lower sacroiliac joints as well. Sometimes extra what you call intestinal manifestations of the inflammatory bowel disease, especially in children, the Crohn's disease can present with extra intestinal manifestations, and arthritis is one of them. And sometimes that arthritis can happen in the sacroiliac joints, and they can present with low back pain. Spondyloarthropathies is a group of condition in which there is inflammation, especially of the joints in the spine, and that can present with the back pain, low back pain or upper back pain. And then SESEA syndrome, which is seronegative enthesitis and arthropathy syndrome, in which they are usually RF factor, rheumatoid factor negative, inflammation of the tendons and inflammation of the joints of the spine, and that can also present with low back pain. Then we have got mechanical reasons for low backache. These are usually, mechanical reasons. If somebody has, let's say, lifted up something heavy, and the muscles or the ligaments get stretched, or sometimes part of the disc can prolapse, which we call a spondylolisthesis. That can, impinge on the nerves and not only cause low backache, but it can cause like sort of a radiative pain along the course of the sciatic nerve as well. Then there are certain things which can happen with like, chronic stress on the lower back. I mean, not directly trauma related, but obviously they are sports related, or they are like repetitive strain related. And one condition that I would like to mention is spondylolysis. So spondylolysis is the fracture of the pars interarticularis, usually occurs because of the repetitive, like, when there are rotational forces around the spine, and this usually occurs in ballet dancers, in gymnasts, as they're just turning and twisting around their like longitudinal axis. So the pars interarticularis gets like repeated, and sometimes they can have like hairline fractures, and that gives them, low back ache. Schurman disease, which is basically a form of kyphosis, fixed kyphosis of the upper back, and they usually have got hunched back appearance, and because of that, they got the pain in the whole back. They've got a very typical hunched back appearance. So that can also cause low back pain, and sometimes a vertebral compression fracture. If somebody jumps from, like, from a height, and they land, and because of the, compressive axial forces, like, so sometimes the in between the lower the lower lumbar vertebrae can get sandwiched between the upper one and the lower part of the body, and that can give a sort of a compression fracture of the vertebra. So that can also cause low backache, and these are some of the uh, groups of conditions which can cause lower backache. Apart from this, then we have got the malignancies, though relatively rare in children. But some of these spinal cord tumors, bone tumors, like osteoblastoma, Ewing sarcoma, osteosarcoma, neuroblastoma, aneurysmal bones, like, these are conditions which can arise primarily in the bones. Rare, but if it does happen, and again, spine is a like, it's a place where rarely these tumors would be found, because usually these tumors are found in the long bones or the other bones. Still, it can happen, and if it happens, it can give them low backache. Some of the systemic diseases, like hyperparathyroidism, like secondary hyperparathyroidism, which can occur because of, let's say, renal disease, in which, like, there is low calcium, and that leads to activation of the parathyroid glands, and, then the calcium is mobilized. So obviously the bones become very weak, and, there are a lot of stresses on that, especially those bones which are prone to compressive forces. They can then develop, pain in that particular area. Low back being one of the, the part which like takes the brunt of the human body weight, so that can be affected, causing low back pain. Sickle cell anemia, they can present with different types of pain syndromes, and just like they can have chest pain, abdominal pain, they can have low backache as well. Similarly, those who are on steroid use, and they get like, weak bones because prolonged steroid use for any reason, like arthritis or asthma or something, they can develop weak bones, like where there is a lot of mobilization of calcium from the bone. So these are empty bones, and we call them osteoporosis. Some of the other conditions, which non-inflammatory conditions, like fibromyalgia, in which you have got like multiple painful spots in the body. So some of those painful spots can be on your lower back as well. So fibromyalgia, the form of they call the chronic fatigue syndrome. It's related with that. So that can cause, backache. Reflex sympathetic dystrophy or chronic regional pain syndrome can happen in the lower back as well. Conversion disorders, like, psychiatric illnesses, pain amplification syndrome, and psychogenic, reasons can be responsible for low backache. So these, like, there is a whole plethora of different reasons, starting from infections, inflammations, repetitive strain, malignancies, systemic diseases, which can give a low backache. So usually we have to work up, because we are talking about non-traumatic backache. So where, like, certain things can give us a clue, like for example, somebody's got fever and, looking toxic, or somebody got a history of TB, then it becomes easy. But in many cases, there might not be history of these things, and then we have to do a bit of workup to find out what could be the reason of these low backache. So how do we evaluate now? $1 million question. So obviously it always starts with the history and physical examination. You cannot undermine the importance of the history and the physical examinations, for how long they've been having back pain, what actually precipitated the back pain. So if it is non-traumatic, like what were the circumstances which started, what, like, makes a pain worse, like what makes a pain better, what are the associated conditions, whether there is any radiation, especially any neurological associations, things like that. So you have to do a complete physical examination, and in physical examination you look at the back to see if there are any tender spots. You look for any exaggerated lordosis, any kyphosis, scoliosis. You will see if there are any masses palpable, and you will check the range of motion and on the lower spine to see what is the degree of flexion, extension, and sidewise, sort of a spiral rotation. You also look for any point tenderness which you find on the bones, because of point tenderness can, actually point towards a focal pathology, like for example a fracture of the pars interarticularis, or a trauma, what you call as a stress fracture, things like that. Many times you might have to do a bit of evaluation for the inflammatory markers. So you might have to do a full blood count, check for the erythrocyte sedimentation rate, because certain things, like for example, multiple myeloma, you will be having a very high ESR. If there is, let's say, tuberculosis of the joints or of the bone, again, the ESR would be very high. You might do a urinalysis to see if there's anything pointing towards like a urinary pathology. Okay, so like for example pyelonephritis or something. uh, People who might have Lyme's disease, they can also present with arthropathies, with few other things. So you can do a Lyme's teeter. And obviously if it's a male and lower sacroiliac joints involved, and you find that the eyes are also where, you probably want to do an HLA-B27, because this has got a very high association with ankylosing spondylitis. Then coming down to the radiological assessment. So obviously always starts with the plain films, x-rays of the lower back. You have to do an x-ray AP and lateral of the lumbosacral spine, and that also includes the oblique view. Why oblique view? Because oblique view is very good, sensitive in picking up fractures of the pars interarticularis, the condition that we call as spondylolysis. Spondylolysis is not very easily picked up on lateral views or AP views. So if you are suspecting that, like for example, in teenagers who are doing these, who are basically gymnasts or doing a lot of like these types of sports, and you are ordering an X-ray also, request for oblique views. So oblique views are very important, especially if you are looking for any fracture of the pars articularis. Many times X-ray would not give you a very complete picture. You still have got many differentials, and the probably you need to do some more investigation. So bone scans are good enough, like nuclear bone scans can pick up osteomyelitis. Similarly, if the bone scans can pick up certain types of tumors as well, there will be hot areas in that particular scans. And last but not the least, you can have a CT and MRI. So CT is good enough in picking bony pathologies. MRI is good enough in picking up like spinal pathology, especially those related to the spinal cord. So if there's any bone pathology which is causing some neurological symptoms, as I told you earlier, that in history and physical examination, if you find that there are neurological symptoms associated with that, like for example, what could be the neurological symptoms? Like if somebody who has got urinary incontinence, who's got saddle anesthesia, or who's got pain shooting down the buttocks into the legs, side of the legs, or into the feet. So this is neurological. Or they got weakness of the lower limbs. So in that particular case, we must have to do an MRI, because neurological conditions can only be picked up with an MRI, especially if there is Cauda-Equina syndrome, or if there is a spinal canal stenosis, or if there is a spondylolisthesis, like a herniated disc. So they can only be picked up in MRI. So MRI is a very sensitive tool, especially when there is association of neurological signs. So neurological signs for black pain, obviously, um, you have to arrange for an MRI. Some of the warning signs which can be associated with these back pain, which means there is what you call a sinister reason for that, are: number one, as the pain increases, if there's a gradual increase in pain over a period of time, it means a progressive pathology. Obviously, it could be tumor, could be anything. So that is one red flag. If that back pain wakes a child from the sleep, more of a nighttime symptoms, again, that is another thing that should worry you. If there is functional loss in terms of the quality of life being affected, simply means that the back pain is of that intensity that it's like limiting the quality of the life. So again, that is something that to look into. Weight loss, so if there's a weight loss, probably means that there's a progressive pathology, probably a carcinogenic one. Fever, obviously fever means that there's an infection or a severe inflammation going on somewhere, needs to be assessed. Or bladder or bowel dysfunction is something which we always like worry about. Simply means that there is some form of neurological compromise in the lower spinal region, and that immediately warrants an MRI. So you have to arrange a quick MRI, and that's a warning sign. And especially if a child is very young. Very young mean, I mean, not talking about infancy, but usually back pains are rarely heard of in a child who's less than 5 years of age. If somebody who's has got low backache and is less than 4 years of age, I think there could be some reason for that. So you have to quickly evaluate them. Okay, so two important things like discitis, osteomyelitis, things that how do they present? Like discitis is a rare thing, but it's basically inflammation of the intervertebral disc and can happen um, when there's a bloodborne infection and it seeps into the disc. Usually these are like I mean, a healthy disc very rarely gets infected. So either the child has got some form of immunocompromise, or there is local damage to the disc in form of repetitive strain or something, that the disc becomes more prone to pick up like pathology from elsewhere. So if that happens, um, you will see that these children, like they have got fever, they're very irritable because of pain, they are very stiff, like, so they would not move their back much, they would be laying still on the bed. So most of the time they would say that he's not able to lift up from the bed, he prefers to lie still. Any little bit of movement when he tries to you know sit up from bed, because he's flexing his spine, that causes him uh, terrible pain. And the thing is that you will see that if you do an x-ray, normally, as I told you, that these types of conditions would warrant an MRI. But even on a plain x-ray, you would see that, for example, if you see in this particular x, so here you see that these are the vertebrae, and this space in between is the intervertebral spaces where you got into. So if you look, there is uniform intervertebral spaces, which means that they are this. But this one here, where the arrow is, you can see that it is narrow as compared to this one. So here you can see a lot, but here the distance is very thin. Can you see this, like just like a black thin line over here? So that means that between these two vertebrae, and that is probably between L2 and L3, you can see that the space is quite narrowed. Why would the space be narrowed? Because there is infection going on. So when there's infection, it causes lysis of the intervertebral disc, becomes more liquefied. So the pressure of the top vertebral disc as it is going down, so it will just squeeze it, because there's nothing in between. There's no cushioning effect, is gone because liquefied is infected. So you'll you will find that the space, intervertebral space, is narrowed. You can see the same thing here, as well as you can see in the lateral view. So you can see a good intervertebral space, good intervertebral space, good intervertebral space, good, but here you can see that there is narrowing. Why there is narrowing? Because it's infected. When it's infected, obviously, cells die, they become liquefied. Pressure from the top vertebrae just presses down, because that cushioning effect is gone. It's liquid. So um, that is what you see on the uh, X-ray. Obviously, best thing would be to do what you call as an MRI. There are a few things. I mean, conditions that are very confusing because they have got similar names, and sometimes even the very experienced doctors get a bit confused, because when you talk about spondylolysis, spondylosis, spondylitis, spondylolysis, what does these mean? These similar sounding conditions, let's discuss one by one. Spondylolysis. So look at the spondylolysis. There's a lysis at the end. Lysis means breakage. Here, the breakage means, what is the breakage? Breakage is of the pars interarticularis. If you do an oblique view, you will see that the pars interarticularis, where the transverse process of one vertebrae joins with the other one, usually there is a fracture. So here, if you see, and there's a special sign for that, we call the Scooty dog sign. So if you look on an oblique view, the transverse process in the pars interarticularis looks like a dog. So if you trace like this, it looks like a Scooty dog. So you can see like it's a dog with its head, and so usually you see that around the neck of, you make this hypothetical like sort of a dog like an outline, you will see that there is a fracture the neck of this. So there is a breakage. You will see a blackish hypolucency, whenever, because bones are white, so when there is a fracture it would appear as hypolucency, blackish lines. So there is a blackish line going between that. Obviously, there should be no, because there's no air between that. So if a black line appears here, it means that there is a fracture of the pars interarticularis. So we call it spondylolysis. Then the second term is spondylolisthesis. Listhesis. Spondylolisthesis. Listhesis means in between one of the what you call the vertebra, it slips. It slips on the top of the other one. If one vertebra slips on the top of the other one, what would happen? Because at the back of it is this here is the spinal canal going. So if one slips, or whatever, there will be stretching of the adjacent spinal cord. So when there will be a stretching of the adjacent spinal cord, the spinal cord would get irritated. And when it would get irritated, all the nerves arising from that particular area, there would be pain in the distribution of that particular area. So spondylolysis means when one vertebra slips on the top of the other vertebra. This usually happens when somebody is lifting a very heavy weight, and in the process the vertebra can get fractured. So whether it gets fractured or doesn't get fractured, if it slips on the top of the other vertebra, we call it spondylolisthesis. Then spondylitis. Spondylitis simply itis, inflammation. This is an inflammatory condition of the intervertebral joint. So when there is inflammation of the intervertebral joints, facet joints, pars interarticularis, we call it spondylitis. And spondylosis. Spondylosis simply means that with the age, there is osteoporosis of the spine. So the vertebrae, they become weak. So when the vertebrae, they become weak, there will be lipping, there will be collapse, there will be deformities, and with that they can have neurological or maybe non-neurological complications, but it simply means age-related degeneration of the spine is spondylolysis. So spondylitis is inflammation, more like you can compare it with rheumatoid arthritis, like the arthritic condition. Spondylolysis is more of a degenerative condition comparative with osteoarthritis of the spine. So remember, these similar sounding terms, they mean different things, so you should be able to know what these terms they mean when we use them in our routine practice. Then coming down to spondylolysis, which is common in children. Common in the sense that, again, I told you in the beginning that these things are rare, but within those rare things, the common cause can be spondylolysis, because kids teenagers especially, who are doing a lot of dancing and gymnastics and things like that, because of the repetitive strains, the pars interarticularis get fractured. So where one, facet of the one vertebra is joining with another one, can simply develop a stress fracture. So I told you we need an oblique view for that. And an oblique view, you look at the what you call this, the screw dog, there will be a fracture. For example, here you can see that there is a fracture running through the pars interarticularis. So this is basically a what we call as spondylolysis, and usually happens in gymnasts and belly dancers and kids who are doing these types of sports. Usually they present with low back pain, and though obviously there's no history of trauma because they are doing the sports, but it's a stress fracture, so there's no trauma. but they would be complaining of low back pain, and usually there is point tenderness somewhere, like around the lower lumbar vertebrae. So usually if you press it and it hurts, um, that means that it is, and you can do an oblique x-ray, and that can usually the treatment is conservative, so just rest, and usually it heals with rest. So that is spondylolysis. Human kyphosis is like a fixed deformity of the upper vertebrae, where the normal curvature of the spine is lost, and it leads to a hunchback. Usually if you examine these kids, when you ask them to bend down and touch their toes, keeping their knees straight, you will see like there's a form of a hunchback. And usually if you do the x-ray, you can not only see the deformity, the excessive kyphosis, but you can also see what we call the small nodes, where there is some lysis in the adjacent parts of where the vertebrae they attach with one another. And usually this is either treated with painkillers, because obviously that is putting a lot of pressure on the back, on the ligaments, and it hurts. The other thing is they can be they can be treated with brace. So Milwaukee brace is a type of brace where it, like attaches below the chin, and it's like keeping, so their body's in a brace which keeps the spine in a particular posture and also keep the neck extended. So they have to wear that brace for over a period of time to treat the excessive kyphosis at the back. So that can also lead to pain. Schumann's kyphosis. Here you can see the Schumann kyphosis. You can see the exaggerated, curvature of the upper thoracic vertebrae, and obviously because it's stretching the spine, they can have low backache as well. So not only the upper back pain, but the lower back pain as well. Here you can see, uh, you see it's going in a sort of a particular direction, though AP view is not that much helpful. Basically, the lateral view gives you more better assessment of that. Then we have got the enthesitis and ankylosing spondylitis. I told you earlier, more common in people who have got HLA-B27, and usually most of them are males. They not only have got like inflammation of the sacroiliac joint, and then later on the fusion of the uh, intervertebral joints leading to a bamboo spine. They also got enthesitis. Enthesitis is a condition in which there is inflammation of the tendons and the ligaments. So where the, let's say, the Achilles tendon, it attaches to the heel, that area would be very painful. Where the quadricep tendon attaches on the tibial tuberosity, that is very painful. So wherever the big tendons they attach to the bones, they are very, there's inflammation, and these areas they hurt a lot. So if you examine these children, if they got like ankylosing spondylitis, so if you check their patella at 10 or 6 o'clock position, where there is tibial tuberosity and where the tendons are attaching, you'll see that those areas are more inflamed, more painful as compared to the other areas. They would be having some form of heel tenderness as well, because of the plantar fasciitis, because of the Achilles tendinitis, and again, wherever you find tendons, and if you press them, there will be some form of pain over there. These are, we call them seronegative arthritis, because if you check them for rheumatoid factors or the other types of agglutinating factors which are mostly present in blood of those people who have got some form of arthritis, these people, they do not have it. It's more like related with the antigens, special class of antigens which are present when HLA-B27, which leads to a class of a monoclonal antibodies which starts attacking the joints, and that leads to then arthritis. And arthritis, when it heals, it leads to fibrosis, and that fibrosis leads to stiffening of the joint, so on and so forth. Some of the differences between juvenile rheumatoid arthritis and juvenile ankylosing spondylitis is: number one, mostly males are affected in ankylosing spondylitis, 7 to 1. So like 7 to 1 ratio, as compared to the opposite in JRA, where females are more affected. Age of onset, again, you see juvenile idiopathic or rheumatoid arthritis is more early onset, where juvenile ankylosing spondylitis it's more often in the teenage group problem. Back pain is always present in ankylosing spondylitis, rarely in juvenile idiopathic arthritis, which would be mostly present in the wrist or in the knees or in the ankles. And I told you HLA-B27 is mostly present uh, spondylitis. Tendon-related problems are common in ankylosing spondylitis, rare in idiopathic arthritis. DNA factors is mostly positive in rheumatoid arthritis, rarely in ankylosing spondylitis. And again, iritis, usually if you see it's chronic iritis or iridocyclitis in rheumatoid arthritis, but it's acute in ankylosing spondylitis. And again, it has to be treated, otherwise, they can lose their eyesight as well. Some of the psychogenic conditions can cause low back pain, and these are pain and amplification syndromes. So what you see is that there is nothing on physical examination, but their pain is like, you touch them and they would be screaming, and you do all the tests, you do x-rays, you do blood tests, you do MRIs, everything comes out to be normal, but the child is screaming and sometimes refusing to walk or mobilize. So the thing is that this pain is always out of proportion to the clinical findings. And again, you would see the very weird type of pain. It's not falling anatomic boundary. It's not like, oh, pain at the back and pain at the upper and pain going into the buttocks as well. But there is no, like, so you do the nerve conduction studies, you do other things, and everything comes out to be normal. So it can be associated with some of the autonomic findings like renal pain syndrome, Sudex atrophy, Coselgi, or reflex sympathetic dystrophy, more or less the same things. It can be associated with fibromyalgia. It can be associated with hypervigilant or like type A personalities, those who have got anxiety and generalized anxiety disorders and things like that. So it can be associated with those who have got some form of conversion disorder, or those who have got some form of non-epileptic seizures, things like that. So the thing is that usually in these particular cases, if you see, because if you find a cause, it's easy to treat. But if they've got these types of pain amplification syndrome, you see they are already on painkillers, that's not working. And one typical thing in these things is that, instead when these patients, they come to the ED, or it's mostly not the patient themselves, but those who have come with them, they are like speaking for the, oh, he's got this, he's got this. It's more of a parental anxiety rather than, the child themselves, complaining of the pain. So in other words, mother is a spokesman and giving like all the subjective complaints. And again, as I told you, that you will find a marked disability despite lack of physical findings. And they might have other things like she hasn't got sleep, she has lost her appetite, she has got abdominal pain, okay, allodynia, which is pain dependent. So all these types of things, okay, they will be present in that. So they need some form of like psychotherapy, or maybe some form of if they need medications, that would be some form of like psychogenic medications rather than painkillers and things. So they can be treated with desensitization or aerobic exercises, physical therapy, cognitive behavioral therapy, maybe some form of muscle relaxation, hypnosis, and rarely, some form of antidepressant like low dose amitriptyline, or selective serotonin reuptake inhibitors like fluoxetine, citalopram, things like that. So they can be treated with that. So uh, these were few of the sort of localized reasons of low back pain in children, and there could be some other reasons which we call as the X musculoskeletal reason, where the problem is not in the lower back, it's because of the structures which are adjacent, like for example menstrual pain, or during periods, pain can be referred to the back and causes the low back pain. Endometriosis is an important condition, which there is like growth of the endometrium on the ligaments of the, let's say, the sacroiliac joint or something, and it can give them like cyclical pain. Chronic pelvic pain is a thing in which there would be some form of muscle instability of the pelvic floor, and that can give them some form of pelvic and lower back pain. Retroperitoneal pathologies, like for example retroperitoneal fibrosis, or kidney pathologies like kidney infection, stones, and things can give them low backache. So these are some of the other reasons that can cause uh, low backache in children, which you should keep in mind. And for example, if you're not able to find a musculoskeletal reason for that, then you can think about these conditions as well and try to exclude them as well. So, then in a nutshell was a lecture on the causes of low backache in children. Again, as I told you, not a common problem, but when it occurs, it does present as a diagnostic challenge. The key is to take a good history, do a good examination. In examination, again, you will examine the back for the range of movements and for the tender points and all those things. But remember, see if there are neurological signs with it, or because if they're neurological or systemic signs, then you know what you are dealing with, this special group of disorders which can present with that. And if you don't find anything on that, then you can think of X musculoskeletal reasons as well. Remember, your investigations are guided by your history and physical examination, but nevertheless, I mean, the X-ray, including the AP, lateral and oblique view, neurological science and MRI, and depending on if there are systemic or like generalized, then again you can do sort of urinalysis or maybe some blood tests and things to look for associated raise in inflammatory markers and things like that. So I hope you have liked this video. Give me a thumbs up if you have liked it, and if you have not liked it, well, I mean, tell me what can I do for you to make you like my videos. And if you haven't subscribed to the channel, please do subscribe and share it with your friends. Spread the knowledge. And last but not least, if you've got any questions, any queries, put it down in the comment section below. Ask me. I'm always happy to help you. So that's all, folks. Have a good day. Bye bye.